Thank you,
But now that,
thank you, sir. Thank you,
thank you. And
Sahani
Dr.
sir.
Albert will nice seeing you in the English program. But I will not join. I have to go another appointment right now. Okay.
Thank you,
Thank
sir.
you.
Thank you. Thank you. Thank you all. Now, today is our guest is Dr. Prakash Rao. One minute. Our 955th day of our swimming, it is coming to more closer to our destination of 1,000 days. So I think that the guests have joined. So today's our guest is for the English, Dr. Prakash Rao. Sir, are you joined?
Not at join. I shall call. Please continue.
Okay. So we know that wonderful days are coming. Now, in 3 languages, we are going to increase the regional languages in our platform. Now, our national language, international language, and our national language. After that, we will start each and every area of India, in every area of the world. There may be different sections, and all languages will come together, and all will enjoy the pleasure of humanity, sharing the wisdom and knowledge. We all growing. So we know that our guest is Dr. Prakash Rao. Before starting our English session, let us have an 1-minute silent prayer. Thank you all. Today, we all know that Dr. Prakash Rao is BA MD in Homeopathy, holding a postgraduate diploma in physical medicine and rehabilitation, undertook projects with UNICEF and AIDS Control Society, and the winner of many awards for the outstanding work for homeopathy. More than 30 years of experience as Central Counselor for Homeopathy. He's a great personality and hardworking personality, a scientist, and he is opening several things. Today, he already done many lectures in our platform. Today, his topic is effectiveness of homeopathy in autism. This is the part 2nd. Last time, what is his, I feel he is an eminent personality with humbleness, very gentle person, and always having a great admiration for others. And he's a wisdomful personality, very generous, highly humility. His humility is wonderful. So let us welcome Dr. Prakash Rao. I think that he might have joined. Because sometimes there may be some network problems. Let us wait for some time. Before that, Doctor, for the time being, let us have some talk. Dr. Sridhar Group, sir, you are continuing from Hindi to, yeah.
Yes.
Autism. Today the subject is autism.
Yes.
Your favorite subject.
Yes, definitely. That you know that I sent one that autism cured case that we recently, that about 6 months back, one patient from America called me. They tried everything, and he was having only 5 years old. They that boy was not talking. He was walking onto the, not putting that his heel into the not touching in the heel, and he was not able to talk, or he was not passing the motion. And even he may pass motion, he will run around, and he was not sitting in the toilet. He may run away from to the classes. So they are thinking to put him in special schools. Then later they contacted me. I took to the case and repertorized that the last I gave that to the medicine, that is Tarantula Hispania. Then that now he started talking, and he's absolutely all right. Earlier he was not sitting for even hair cutting. It is completely, even just that Dr. Sakani was telling that I prescribed to the Tarantula 0/3 only. 0/3. SOS. Whenever it is required, that time. But he is completely about to the 95%, it is good. But in any other system, I can assure you, any other system in that this they cannot cure that the autism, but we can cure. Not only autism, even ADHD also, learning disability also, such type of to the these psychological problems we can easily cure with homeopathic medicine, I can assure you. That is the result we are getting. Of course, all cases we cannot cure 100%, at least 70 to 80%. Slow, steady, but definitely that the patient will improve. That is my result. Still, I am getting patients and getting good result. This is my, whether Dr. Prakash Rao is not joined.
He doesn't join.
You please try to call him. That it is
Yeah, Dr. Danesh is calling, I think.
okay, because time will go, he may not get time. I can talk, of course. I can talk hours together without referring anything.
So, doctor, what is the while this operant conditioning? It is in psychology. There is a method of operant conditioning. They are giving instructions and everything for doing all these things. That may call operant conditioning. How it may affect in autism cases?
It will complement each other, because there is a one Dr. Joseph Wadakan from Trichur. He is giving a class. I am attending every day, every week once. That is in Monday, 7 to. That is why nowadays it is difficult for me to 7 o'clock to join with that, because that 7 to 9 o'clock his class is there. And Tuesday, every day, there is a about to 50 to 60 people are, there is a group. They are discussing this problem every week. So that is also possible. It will improve, but the 100% they cannot assure. But their improvement is about 50, 60. Of course, when the age progresses, definitely every person require 1 year. These children may be 2 year, 3 year, 4 year, or 5 year. It is required. They are physically grown up, but mentally they are not grown up. But in our medicine, with such type of the psychological treatment or that type of to the special treatment, some exercise, some behavior changes, if they may patterns may change, definitely they will improve without medicine also. But when our medicine is there, it is just like that a catalyst, it will work very quickly. That is my experience that I like to share that here. Of course, you record people may tell, and you also try. You are knowing these two things. You also try, you will get the good result. Both will complement each other, and what they are getting, double benefit we will get. Whether Dr. Prakash Rao joined?
Dr. Danesh?
Hello, there is some technical network problem with the sir. Sir is trying to join from 8 p.m. onwards, but due to some network problem, the sir is unable to join and trying to join. And so you may continue discussion, sir. And sir, for the time being. You can speak about autism for the time being.
Okay, okay.
Dr. Hubert, you tell what about your experience and your opinion?
Yeah, sometimes it may be very difficult, but in cases, in addition to that, I feel that some spiritual problems is also, there may be related with autism cases.
You talk 1 minute, I will come. 1 or 2 minutes.
Okay.
You talk.
That is another thing. Some family living in some conditions, some parents doing some spiritual evil things. So that was it can be seen in possessed. We call it as possessed. In some cases, there is possessed conditions may be there, evil possessed, spiritual problems there may be there. In such cases, we might have misleaded what is the reason for the child. That time, sometimes prayers will give much improvement in the child. For regularly practicing the spiritual enlightenment and classes and training, a great extent, it may give improvement in that type of patients. Small children, it may also, whenever the patient is growing, the person is growing, the conditions will be there. In Hahnemann says in his last aphorisms that some forces, yesterday it was discussed, mesmerism and all, passing, and other kinds of energy utilizing for to overcome this type of maladies. Many having such experiences. Whenever a person or that family involved in black magics or spiritual bad things related with black magics and like that manner, it may produce that, it may be like a curse, it may go throughout their life. We know that curses, all religion says about curses and blessings. What is curse? The curse, we can see that in Ken's lectures, he says that the first sin, the man was with the law, obeying the law, the commandments of God. When they are left it, they turned from God to the other forces, just opposite forces. They become blind. In spiritually, they become blind. They were with God. Man was with God. But what happened after it sin? That is what we called. Ken says that the first sin, that is Sora. Wrong knowledge. When we are traveling in a road, we have to obey the laws. There may be some laws, while there are some laws in the traffic rules are there. Laws and rules are there. We have to obey the rules in a traffic, while we are driving a car or we are driving a motorcycle or walking, we should obey the rules of the road. If we are against the rules, that time accidents will happen. If there is a rule that we have to go aside, through a side, you have to travel. If we are purposefully done it opposite direction, there is chances for accidents. That is also very much related with the human life. Whenever we have some principles, laws, and ethics, everything we have to obey. If the ethics is not obeyed, if the rules are not obeyed, if the commandments are not obeyed, our quality of human life will go down. It may go from one generation after one generation to people. A person who is doing robbery, his children also learning from him that robbery is good. Making money not in the right way, if they are seeing that his farm, the parents are doing such things, he may study from them, he may learn from them, and he may practice it. If we in psychology, there are some values. Values are there. We have to study the values of human values. What are the values? If we doesn't know the value of or the principles of living, that time the danger will happen. I think that on is it POCO M3?
If he may not come, I shall take to the class about autism little bit. I can tell whether it is possible.
Pardon, sir?
If he may not come, I can take autism.
Yeah. You can do it, sir.
Yes. If he may come, I shall stop it. Okay.
Okay, sir. Okay, sir.
Autism, that is the early diagnosis of autism, initiating appropriate treatment and its regular assessment. Autism refers to a spectrum of neuropsychiatric disorders characterized by poor social interaction and communication, delayed speech, unusual and repetitive behavior. The cause is usually idiopathic and genetic factors seem to be important. Incidence affects approximately 0.5 to 1% in 1,000 children worldwide, with a male predilection, male and female is ratio is 3:1. Concordance rate in monozygotic twins is 90%. Usually diagnosed before age of 3 years. Rarely diagnosed in infancy. Varies from mild to severe in degree. Severely affiliated parents appear profoundly retarded. Clinical features and diagnosis. When he may come, please kindly tell me that I shall stop, okay?
Yes, sir.
Clinical features and diagnosis. Cases with complaints, initial signs. Child unresponsive to people. Child focusing internally on one item for long periods of time. Engaging and bubbling toddler suddenly becomes silent, withdrawn, or indifferent. Social overturns. Other signs. Child does not bubble, point, or making meaningful gestures by 1 year of age. Does not speak one word by 16 months. Does not combine 2 words by 2 years. Does not respond to name. Loses language or social skills. Poor eye contact. Doesn't to be know how to play with toys. Doesn't smile. Restricted and repetitive interest and behaviors. Then check and look for IQ scores. About 3 by 4 of autistic children have the IQ of below 70. Associated disabilities. Hearing impairment seen in 20% cases. Epilepsy seen in 25% cases. Refractive errors and squint. Probable cause may be autism. What to do? Examine, investigate, assess the child's neurodevelopmental, cognitive, and level and language abilities. Ophthalmological checking, audiological testing, speech assessment. Consult a psychiatrist before labeling the child autistic. An individualized treatment plan designed to meet the child's unique need is essential. Start if all these things are there. If there is not that much problem, then start homeopathic treatment. Then behavior modification, special education, speech therapy, occupational therapy also will be helpful. Follow the long-term treatment is required. Assess after every 10 to 15 days to evaluate the improvement. Child shows improvement in social behavior, improvement in eye contact, improvement in education and communication skills, increase in IQ level, and increased ability to live independently and developmental progress. Then some children are able to develop their communication and social skills to a degree that allow them a fair degree of independence. Others can learn some skills but still require ongoing support from their family and other throughout of their lives. Also look for other diseases similar to autism are Weller's disease, Rett syndrome, and Asperger's syndrome. What is Weller's? Normal development to age of 3 or 4 years, followed by abrupt onset, fretfulness, negativism, anxiety, regression of mental development, gradual loss of speech. What is Rett syndrome? Occurs only in girls. Initially, child shows normal development, then reverse and shows severe psychomotor retardation. Abnormal gait, inability to control hand movements, inability to express feelings, microcephaly.
Justice, please. Sir, the justice, please.
Okay. Sir,
Sir,
thank you very much.
Prakash Rao, sir.
Yes, sir, most welcome. Yes, thank you very much.
You are welcome, sir. We already introduced
Yes, sir. Good evening, sir. Good evening, sir.
Everybody knows you. So if I say more thing, then it will be absurd. So, sir,
Ganesh, sir, I joined the meeting.
Yeah, you can start now, sir.
Okay, sir. Yes, sir. Sir, you have to allow me to share the screen.
Yeah, you can
My
share.
slides I have to share.
Just a minute, sir. Please, sir.
See, I have a habit of speaking.
Yeah, I can do it. Yeah, now you are co-host, sir. You can do now.
Can you see my slides, sir?
Yeah, you can, sir. We can see, sir. But installation failed. That is.
Okay, sir.
Yeah, okay. Now it is okay.
Sir, this is about autism. See, sir, how much time I have to speak?
Now you can do it for 20 minutes, sir. After that, there will
okay,
be
sir.
discussion.
Okay, right. Now, last time we have seen good evening to everybody. Sir, Krup, sir, good evening. You are speaking. I am very sorry. See, today link and that program might have delayed us. Okay, this is about understanding the autism. Autism is a hidden disability. These are side just for your just for your making you fresh. These are the facts about the autism. Social interaction impact in the day-to-day life. People who have autism will have these things, deficiencies, how these deficiencies, these all you can see from my previous slides. So what is this problem solving? What is the planning? This I am not going to discuss, just only to make you a fresh, adapting the treatment to autism persons. Now this is from today, this is the thing. Autism is a complex, lifelong biological disorder of development that results in social interaction problems, communication difficulties, and restrictive repetitive interest behaviors. In the majority of those cases, there won't be any specific underlying cause can be identified. However, various factors are present like genetic and everything. This is the cause of the, what is the genetic factor? Why I am going to discuss today about the genetic factor is the genetic disorders, the chronic diseases, and homeopathy goes hand in hand. Once we understand the genetic disorders, the most modern system of medicine, we will understand homeopathy very thoroughly. If we understand homeopathic chronic diseases, we will understand these genetics and immunology very easily. So autism is a result of genetic susceptibility that involves multiple genes. What are those genes? These genes that causes autism also contributes to infertility. See, such type of study has been done by modern genetics people. So when the genetic scientists have told the genes that are causing autism are also contribute so much to the infertility. So infertility means something connected with endocrines. Endocrines disturbance means something connected with women. Something connected with women and autism. That means in homeopathic literature, these are the important things where we can prescribe a drug and understand the patient on the basis of chronic diseases. So these mutations of fragile X messenger ribonucleoprotein 1 gene, FMR1. This is the gene name. I am going little more knowledge. It is nothing causes. We need not take it very seriously. These all can be understand when we read chronic disease more and more. So this is the gene that these genes also contributes to infertility. Infertility means something connected with endocrinology. Endocrinology is something connected with immunology. Immunology is something connected with genetics. That genetics something connected with autism. So autism is autoimmune genetic disorder. Where the word autoimmune comes, there the homeopathy comes. There the homeopathy will be successful. Because it is genetic, according to our organon of medicine, because the genetic disorders are present, that doesn't mean we are not going to treat those genetic disorders. We have to try as a physician how to reduce these genetic disorders not to occur again, and how to relieve the suffering of the patients is most important. See, everybody says in homeopathy, the homeopathy cannot treat. There is no homeopathic scientific approach because nobody has taken care of homeopathy in scientific manner. That's why there is no scientific homeopathic approach. But it is not like that. It is whoever suffers as a physician to alleviate the disorder. It is our primary responsibility to search for a drugs. If drugs are not found, we have to invent the drug. So that should be the aim of the physician as per the third aphorism of Dr. Hahnemann. So these are the genes ADNP, ANK2, ARIDIB1, AS, these are the genes. And genes that are involved in the development of the autism. These are all superficial, you need not go. AVRPA, arginasing vasopressin receptor. Vasopressin means again endocrine. Vasopressin, again endocrine, that will be secreted where the blood pressure, glucomagnetic neurotransmissions, DCSI, and DYXY, even the gene that what causes the disease is unknown. Why I am showing this table is, the gene that causes the disease is not known to them what this gene will cause which disease. So don't think that if we do not know something in homeopathy, it is defects of either homeopathy or a homeopathic doctor. In modern system of medicine also, the DYX1C1, the gene, it is one of the genetic involvement, one of the spare of the gene, why it is not causing. They don't know what is the function of that gene. That means the science that is taking place, it is only research going on, the known things that have to be understood. These all were discussed in our chronic diseases and in our organon of medicine. And these are the genetic development. Then global development, distribution and characteristics. These also superficially. This is autistic disturbance, classical autosomal. This is Rett syndrome, which I described in my first slides. Genetic conditions, mutations of MECP2 gene. It mainly affects girls. See, this syndrome affects the girls' brain development. Child dysexecutive disorder. This is congenitive behavior speech, regression of 2 to 10 years. This is also autistic characters. That means child will have slight deafness. Asperger's disturbance, which I discussed in my first parts, the individual with autistic characteristic develop speech in expected age without mental retardation. What happens this disturbance? The speech, development of the speech in expected stage, but there won't be, the speech won't come, but there won't be any mental retardation. Global distribution of non-specific development. Here the individual with some autismic characters, but not as severe or as extensive. Why these genes, why I am just telling is, these all, if we club our chronic diseases, if we club our miasms, if we think about our organon of medicine, we will understand all these things. So gene-involved development, variants of inherited genes, and here one has to know, though it is a genetic trouble, but father will give 50% of the autism children are from father's side, not from mother's side. Though the girls are affected with autism, the autism that in that girl, the 50% of genetic variant came from father's side. So the father is carrier and father is the person who will spread the disease. That's why it is more prevalent in males than in female children. If the 4 children have been affected, if the 4 male children are affected, 1 female child will be affected. Children with this, suppose if the both autism persons have got married, and if they produce children, their children, the 9% of the children will have more autism. Yes, now I am coming to homeopathic medicine symptoms. Now there are various homeopathic medicines. Just I have taken few: Ambra gracia, Beretta carb, Calcarea carb, China, Supramed, Mercurius, Nux mosquita, Silesia, Lycopodium, Bifo, Medorinum, Laccaninum, Tuberculinum, Calibrom, Carcinosin, Hura, and there are various medicines like Carcinosin, Medorinum, apart from Syphilinum, Tuberculinum, Arsenic album, Aconite. But why these medicines are not working up to the mark? Whatever that has been given in the literature is, during the time of Hahnemann, nobody knows what is autism. Nobody knows what is autism. So, because there was no autism disease present, but the homeopathy was highly developed, they proved the drug. The proving symptoms have been noticed. But when the proving symptoms, drugs have been proved on healthy human being, why Beretta carb, a totally true drug for dwarfism, or true drug for mentally retardation, or true drug for autism, why it never leaves the disease condition? For that, there are two organon rules. One is we have to know what is curable. We have to know what is curative, number one. Number two, suppose take the example of mental and physical retardation, dwarfism in Beta-Carb. Beta-Carb has not produced any dwarfism. When the drug has been given, it never produces even mental retardation. But these people, when they verified the patient, they have noticed those drugs. Moreover, around 250 years back, around not exactly 200, 28 years back, the drug proving, the Hahnemann selected whatever he feels as healthy human beings, he decided to prove on them. So those persons, the healthy human beings, their symptoms were noticed. And after that, the medicine has been given. They were healthy human beings with some of the mind disorders, mental symptoms, or their personality symptoms, and their habits. So they have given honestly their habits, their personality symptoms, then the medicine has been proved on them. Suppose the maximum number of patients proved in the medicine are sulfur and lycopodium, where 60 provers are present. Out of the 60 provers, only 5 provers have produced some of the drug symptom. In Beta-Carb, there are 56 provers. Out of that, only 1 prover has produced 1 symptom to 7 symptoms. So those symptoms also superficially present. Why this dwarfism or mental retardation or physical retardation or late learning, fear, aversion to strangers came? Because one of the abnormal prover also has been given Beta-Carb. When Beta-Carb is verified, in that abnormal prover, he has been cured with tonsillitis. So they have noted down his constitutional symptom, and the Beta-Carb has produced throat infection, and that throat infection is understood according to pathology, little magnified, written that tonsillitis, hardness, lymphadenitis, and whatever the language and signs present in those days. But those symptoms, suppose for example, to make you to understand, I will tell that after giving Tuja never developed wart. In that Tuja patient never developed any wart. The wart patient who has been given Tuja while proving, the wart disappeared. That's why Tuja is a very good medicine for warts. Later, in the clinical practice, many physicians tried basing upon the symptom that they are existing. That's why the materia medica has increased in size, and everybody developed their own materia medica, because the patient with the different symptoms who came, when they selected the similar drug, which is near to their symptoms, the drug also cured some of the symptoms which they never explained, or which the physician not observed, or even after observation, that is not present in materia medica. So these are some of the where we have to self-introspect ourselves. Despite all these things, we are getting the mental symptoms that are needed for autism patients from our literature. But because Hahnemann do not know about autism, because Kent never understood, they never commented anything about autism. But the only one author told something about mentally retarded people is J.C. Burnett. By that time, there were mental and socially, physically challenged persons in the Society of America. So there he has seen, he used homeopathy, and his comment is the use of specific homeopathic, organopathic, and various other constitutional remedies systematically administered so as to rectify the wrong underlying of the said backwardness. The mental retardedness or the autism was addressed as backwardness to cure the diseased organs or parts, to rouse them medicinally from torpidity, because the genetic condition which has produced some of the mental symptoms, those mental symptoms cannot be taken back. That's why he used it to rouse the parts, make the mind more sensitive to response to the medicine, or to cure the disease of the individual as an entity, or to get rid of the perverted or other morbid condition due to hereditary. He understood what is hereditary. Hereditary means again genes, again chromosomes, again genes. So in those days, they understood something is present hereditary wise. Disease that traits are to shocks, falls, blows, fits, and other previously overcome accident and disease. Apart from this, nobody knows that what are the special disease condition and mentally retarded condition. So all the drugs which give some of the symptoms, in that one of the best symptom is hura, biting the nails, absent-minded. After giving the hura medicine to the provers, the biting nail symptom never came. But a prover who was biting the nails, after giving hura, the symptom has disappeared, number one. Number two, a person with biting nails came to some of the homeopathy doctors' clinics, where that is a symptom, but when materia medica is referred, that symptom is not present, but he gave hura, then the patient has, from patient, the symptom has disappeared, and that symptom has been incorporated into the materia medica books. So like that, the materia medica was built up. That's why the Kent materia medica will have around 400 pages. The other materia medicas will be small, because he has explained each mental symptom, how it has to be understood. So like that Kali Brome, but nothing has been tested on patients of autism according to evidence-based lines. But most of the physicians have cured and managed, treated the autism patients. So, but they have not done any investigations. We have here done how Lycopodium, how Calcaria carp, how Medorinum will work on the patients of, because Medorinum is having one symptom, cannot concentrate, forgets names, words, cannot finish the sentence, cannot read the sentence, things seems very sensitive with strangers, nervous, impulsive. So these mental symptoms, some of the mental symptoms are weak memory. Weak memory, how it came? After giving Medorinum, if one develops weak memory, that medical prover has to be cured with the symptoms, the prover's symptoms, but that is not the case. The person with whom they consider as healthy human being developed with weak memory, that weak memory person has been given Medorinum, so his weak memory disappeared. Then that particular symptom has been incorporated in materia medica. This is known as verified symptom. These verified symptoms, they may sometimes will prove successful, sometimes they may not respond. That's why whenever you select any true medicine, any similar medicine, any correct medicine, if it is not working, don't disappoint yourself that you do not know homeopathic materia medica, but the homeopathic materia medica has not been written as it is printed in true. You have to understand materia medica scientifically. When you apply your mind, how Hahnemann has seen weak memory, how many provers have been proven. If you go to Herring's proving, you will understand that, oh, these provers, suppose I will tell you, I told you in my first lectures that calophyllum is one of the best drug in homeopathy to make deliveries very easy and to reduce the pain. But if you go to the calophyllum proving of Hahnemann, no female person was proved calophyllum. He hasn't proved calophyllum on any female prover. All the 52 provers are males. But when the symptoms that has produced, when the symptoms that has been incorporated in materia medica, basing upon that symptom, when a pregnant ladies were given the calophyllum happened to be one of the female remedies rather than a male remedy. So these are some of the secrets and where we have to introspect about our materia medica. Then we have to make the materia medica more modern. For that reason, our senior homeopaths have never allowed, despite they have seen so much of success in their lifetime, they never allowed these homeopathy to be proved on animals, so that if one pathology is changed in the animal, suppose for example, if insulin decreased, increased on rat in diabetes, or if some acid secretion, hydrochloric acid secretion in the peptic ulcer patient increase, decrease according to emotion with carbovig or naxwamica or lycopodium, our homeopathy could have been known as the most scientific system of medicine. But our seniors were apprehensive and they never allowed, even the opportunity came, they never made homeopathy totally scientific and competitive on par with allopathic system of medicine. So these are some of the drugs. This is the Burnett statement. Then when those symptoms are converted into rubric, this I cut and paste from the screen of the repertory chart. So this will be mind hair, having cutting hair refuse. He is afraid of going to a barber. Aversion to light. See, muttering, all these symptoms have been converted into rubric. So the rubric also, when they have seen the materia medica, they could have built up a very good repertorization like Kent or Boninghasen, where the Boninghasen repertory has been appreciated by Hahnemann. Hahnemann has left a special comment in one of his aphorisms, maybe 156 or so, about Boninghasen, a short footnote. And that is not present in other materia medicas, big other repertories, because the repertory that is not covered. Suppose many recent repertories came. The repertory means it is translation of materia medica symptoms into a textbook, so that the younger generation, next generation, next doctor will believe the repertory and can prescribe. With that prescription, the prescription will be successful. But they combined all the repertories, they combined all the materia medicas, they incorporated new symptoms. Those new symptoms have been not verified in this scientific world. So whenever you see the repertory and you give the medicine, if you see 100 symptoms for 100 patients, you will be successful in 7 patients. The reason is the repertories have been not verified scientifically. That's why the efficacy of the repertory of Kent repertory, Boninghasen repertory will be more successful. From the Kent repertory, which came the synthetic repertory, will be little successful. And the other repertories, you will find each symptom, you will be happy. But that symptom is not a verified symptom with our materia medica or drug proving. So these are some of the repertories and their limitations. And after this, these are the drugs. Now I talked about, see, when we understand the genetics, those genetical symptoms will be produced in genetical disorders. If you go to chronic diseases, you will find that what is curable, what is curative, which is multi-miasmatic disorder, which is, suppose, if you go to aphorism 141, Hahnemann talks about mental disorders as one-sided diseases. One-sided diseases means those diseases are incurable, but they can be managed, they can be treated, the symptoms will be kept under control, and the patient can continue his normal life with homeopathy. So the allopathy doctor says they do not know the difference between cure, treatment, management, and therapeutics. They say that homeopathy don't have treatment. As if they have treatment. They also don't have. What they are doing, from diabetes to hypertension, they are suppressing the disease, they are managing the disease, they are controlling the disease, they are not curing the disease. So homeopathy also plays the same role in management of the autism disorders. If we constitutionally prescribe the medicine, homeopathic medicines are also found that they have changes, modification capacity of immunology and modification capacity of genes. So, but we haven't, we studied on clinical studies or clinical research, but we have to take the drug standardization, the quantity of the drug, as well as the clinical outcomes on per the pathological standards prescribed by the allopaths. So that if we take, we will be successful. So homeopathy believes in cure, treatment, management, suppression, palliation. Allopathy believes in no cure, only management, prolonging the life. We also can do. If you give me an opportunity, I will talk about next time. I left one side of the what is the exact sample size that you have to take in your clinics, as well as one case of autism where the pathological condition has been reversed and where the genetic modifications, if the autism is of idiopathic, if the autism is because of infection, if the autism is without involvement of the genes but with the involvement of immunology, such type of autism cases can be reversed back. The immunology can be reversed back. The genetic factors may not be reversed back. Genetic mutations can be reversed back. So the word, though it may look as if the exaggeratory word, there is one word in homeopathic philosophy that homeopathy medicine cures the disease, also prevents the disease. They don't know how it prevents the disease. How it prevents the disease is when the genetic mutations takes place in parents, the child who is going to take birth after genetic mutation will not get the disease that is present in the parents. These all Hanuman don't know, but he has written a homeopathy medicine cures the disease, also prevents the disease. So such wonderful things you may have seen in your clinical practice, especially in the cases of bronchial asthmas. So thank you very much. Today, because of some online defects, some your programs, we are little late. Sir, we can have a discussion, sir.
Yeah. Thank you very much, sir. Now, anybody want to ask or add something? Please raise your hand and we will allow you for a discussion. It was a very wonderful, because he's always like that. He's always doing researches in many papers, many subjects he did, and a great wisdom person. Now, Veena Ganesh, please unmute yourself. Unmute. Yeah, you can.
Good evening, sir. A wonderful session. Sir, thank you for the session. Can you please go back to the slide, Barretta curve, sir?
Yes, madam. Barretta curve, yes. Dwarfism, mentally retarded and physically retarded. Late learning to talk. Fears, aversion to strangers. So, how this symptom developed in homeopathy? After giving Barretta curve, the patient developed this symptom. Otherwise, why it was incorporated in Materia Medica? If it is so strong, when we learn Materia Medica in our classrooms, we think that Barretta curve definitely relieves the dwarfism. A shortest fellow will get the height of 6 feet, but that never works. Why it happened? Because the Barretta curve has grown on one of the dwarf person, and that dwarf person developed sore throat, and that sore throat symptom and his constitutional symptom is recorded. Whether to rectify this error or whether to continue this error, because some of the physicians in their private practice, in their day-to-day practice, they have cured various mental symptoms that are present in Barretta curve. So how they cured those mental symptoms, they have to be studied scientifically, or we have to see their documents, then we have to incorporate that symptom, then we have to make a pathology out of those symptoms, and then we have to see the proving then we have to see the medicine proving on animals, and we have to come back again for proving in healthy human beings. After Hahnemann's death, the exact proving of the medicine took place in some of the institutes, in some of the centers, but the scientific measurement of the proving, like what allopathic doctors test their medicine on the rats, was not done in homeopathy. They have gone directly to the human beings. When the question was asked by them that why the human beings are needed, when the homeopathic doctors have explained that these human beings will produce mental symptoms. But surprisingly, today all homeopathic doctors are giving veterinary treatment, and it is found to be successful, and a veterinary course has been introduced in Kerala, and agro-homeopathy. And allopathic doctors also will call the homeopathy as a placebo system of medicine. How placebo works in animals? It works in human beings, but how animals will produce placebo effect? So the allopathic doctors also, like alcoholics, they talk something. We should not believe their talks. But unfortunately, we also have a lacuna of documentation. That is the trouble with homeopathy.
Thank you, sir. And now, Sridhar Krupp, sir.
Sir, you are a wonderful session. Very good. Come again. And
yes,
if you know Hindi also, you please come in Hindi session also.
Yes, sir. Yes, sir. Hindi session also I will participate, sir.
Okay, if it is possible, tomorrow you please 7 o'clock. You please come and.
Okay, sir. Okay, sir. Okay. Thank you, sir.
Okay.
Thank you, sir. Manoj, sir, I could not see something wrong today with your internet. Now I think by tomorrow it will be rectified. Now, okay, sir. Sir,
anyway, thank you very much. Excellent session. Come again.
Sir, Veena Ganesh, you asked the question. Raise the hand.
Yeah. She asked and you you showed it.
Okay, okay. Sir, ask them to write to my email, sir, so that I can answer them.
Okay, sir, please.
All the persons kindly attend to me the questions so that we will have a good discussion. I also will send all latest update news in homeopathy research, in other research. Okay, sir. Sir,
thank
namaskar,
you,
sir.
It is great.
Namaskar.
It's great.
How about Isilva, sir? Thank you very much. Nice
thank you. Thank you, sir. Now the time for starting our Malayalam session.
Yes, sir. Yes, sir.
You are in your short time you made a great thing. So that is why your speciality. Thank you, sir.
Thank you, sir.
Now let us go to our Malayalam session. I invite Dr. Danesh to continue the Malayalam session. Goodbye and good night, all of you.
Thank you, Dr.
Okay, sir.
Prakash
Thank
Rao.
you, sir.